The seminal gland, VESSICLE. It is a paired gland which secretes fluid components of the sperm. The mucus yellowish secretion contains the substances, fructose, which are needed for the spermatozoa tropism and activation. The seminal vesicle is situated in the cavity of the pelvis, lateral from the ampulla of the vas deferens, upwards from the prostate, lateral and backwards from the base of the bladder. Upper parts of the seminal vesicle are covered by peritoneum. The seminal vesicle tubule is rolled up and folded into a compact flat formation which has the common CT capsule. The external surface of seminal vesicle is knobby, tuberous. The seminal vesicle has three parts. A. The wide part, base; B. The middle part, body; C. The lower narrow part, which pass to the excretory duct. The wall of each seminal vesicle consists of three coats: the mucosa, muscular and coat adventitia, partly peritoneum. The adventitia is formed of the compact CT with a big number of yellow elastic fibers. The excretory duct of the seminal vesicle is connected with the terminal part of the vas deferens. They join together to form a common ejaculatory duct which traverses the prostate and opens into the prostatic part of the male urethra near the prostatic utricles. In place of passing through the prostate, the muscular coat of the ejaculatory duct is continuous with the prostate muscle. The prostate, it is a non-paired, partly muscular and partly glandular organ of which secretion forms part of the sperm. This secretion makes sperm more liquid and promotes the mobility of the spermatozoa. The prostate also accomplishes endocrine functions. The prostate is situated in the antero-inferior part of the pelvic cavity. It looks like a chestnut. The base of the prostate is directed upwards and adjoins the fundus of the bladder, the seminal vesicles and the ampulla of the vas deferens, the lower narrow part of the prostate. Its apex adjoins the urogenital diaphragm. The prostate has anterior, posterior and inferolateral surfaces. The anterior surface greater than faces the symphysis of the pubis and is separated from it by loose fatty tissue greater than the fibrous bundles of pubo prostatic lig and the pubo-prostaticus muscle, presented by smooth muscles. Fibers stretch between internal surface of pubic symphysis and prostate. The posterior surface greater than separated from the ampulla of the rectum by the frontal fibrous recto-vesicle septum. The infero-lateral surface greater than faces levator ani muscle. The prostate has left and right lobes which are separated by a rather shallow groove on the anterior surface. The isthmus of the prostate, middle lobe, is situated on the posterior surface in the region of its base. The isthmus is restricted by the urethra from the front and by the ejaculatory ducts from the back. The urethra enters the main mass of the gland in the region of its base closer to its back surface than to the anterior one and goes out downwards from the thickness of the prostate apex. From the outside, the prostate is enveloped by a fibrous capsule which is structurally continuous with the stroma of the gland by a CT septum. 30-60 alveolar tubular serous prostatic glands form the glandular substance of the prostate. The excretory prostatic ducts of these glands open into the prostatic part of the urethra. 6. The bulbo urethral gland. The bulbo-urethral or Cowper's gland is a paired organ, the secretion of which neutralizes the acidity of the urine that provides the viability of the spermatozoa and also protects the mucosa of the urethra from irritation. The Cowper's glands are situated in the thickness of the deep transverse perineal muscle behind the membranous portion of the urethra. The bulbo-urethral glands are about the size of peas and they have a slightly granulated, rough surface. The lobules of the gland are separated by CT septum. The main excretory duct of the gland pass forward and a little bit downwards. The ducts perforate the bulb of the penis and open into the spongy portion of the urethra.